Congratulations on this day of graduation ceremonies and, of course, receiving your pin, unique to George Washington University School of Nursing. I have my pin from my 1971 graduation at Newport Hospital School of Nursing in Newport, Rhode Island, and I wear it proudly whenever I can, and I know you will too. My daughter Maureen and I attended a lecture this past Monday evening on the Confidence Code. It's a book written by Katie Kay, who's an anchorwoman of BBC, and Claire Shipman, a correspondent for ABC. They wrote this book in the pursuit of the confidence gene. The book was written for women. They examined how a lack of confidence impacts our leadership, our success, and our fulfillment. And they asked many questions, one being, which is more important, confidence or competence? As I was thinking about these statements, I thought of nursing and nurses, both genders, and the implications that these qualities bring to the bedside. You all have learned certain clinical competencies grounded in evidence-based practice. You have performed these clinical competencies in the skill lab and then in the clinical arena to provide care for your patients. And you know how confident you felt when you were able to have the scientific knowledge and the skills come together to provide that patient care. So competency and confidence are both equally important to you as you go through your nursing career. It is critical for nurses to be confident in their knowledge and abilities because confident nurses will speak up when a patient has been treated improperly. A confident nurse will address ethical dilemmas, will challenge unfairness and inequalities, and will strive for positive change. And your best is obviously crucial for the patient, so your confident nurses bring their best to the bedside. But sometimes we start out in our career or a new profession, and our confidence wanes because we might not have all the skills yet, and we might not possess all the knowledge. So what can we do when you first go out into your profession to gain confidence? First, realize you don't know it all. When you come across a diagnosis, a treatment, a surgical procedure, or a medication that's unfamiliar to you, look it up and ask questions. The more you learn, the more confident you will be. Secondly, build relationships. You will need supportive relationships in the workplace, and others will need your support. You will need to rely on each other for assistance with a difficult patient, a sorrowful case, and an overwhelming day. And when people ask you for help, it is a compliment that will build your confidence. Work well with others. Be enthusiastic. Bring energy to the workplace. Leave the negativity and the crankiness outside. Your patients need all the kindness and positive energy you can provide. And at the end of the day, reflect how important your work as a nurse is and how essential that service is to your community and to society as a whole. And be proud of what you have done and what you have chosen to do with your life, because you will be a competent and a confident nurse, and we are and will always be proud of you. Thank you.